Hey everyone, this is Carrie here at Spa Medical. I'm here with Rachel today. She is actually our marketing girl here, and she has been so gracious as to lend herself to a skin consultation. We wanted to take a little quick video of what a skin consult is like here at Spa Medical. We are going to go through that process. I've already asked her some of the private medical history questions, so we've already covered that base. So I'm just going to go down the list of questions that I typically ask during a skin consult, and then we'll come up with a treatment plan, and we'll take it from there. So this is how it goes. Hey Rachel.
Hey Carrie.
So tell me what brings you in today.
Well, I work with so many women here that have fantastic skin. I mean, point being you.
Thank you.
I just really would love to have skin without a lot of texture to it. Skin that I don't have like enlarged pores anymore, because I think I just get discouraged with some of those issues because they've lasted over time. I haven't found products that I use that can really address that yet. So looking to see what I can do about those two things.
Okay. So what would you say is your overall goal for your skin?
Yes. My goal would be to just have skin where I don't have to wear makeup. I can wake up and feel like my skin looks great, it looks glowing, and not immediately run to the bathroom to put on some foundation or some makeup to cover up my skin.
Right.
So,
That is a very common goal I hear from women. They just want to feel comfortable in their own skin and not feel like they have to wear makeup. So I think that's an awesome goal, and it's definitely achievable. So
great.
Let's go over what you're using on your skin. What steps are you taking in the morning? What's your process?
Okay, so in the morning, I wake up, I take a shower, and then I will wash my face. And I'll typically cleanse, and then I put on my moisturizer and my sunscreen before I put my makeup on.
Perfect. Okay. What about at night?
At night, it's a little bit longer of a process, but basically the same thing. I take off my makeup using makeup wipes, and then I will use a cleanser.
Perfect.
And then I'll alternate using a retinol with another product that I can't remember. And then I put on my moisturizer for the night because I have some dry skin.
Gotcha. The reason why I love to ask a patient what they're using at home is so important because it tells me so much. Some people are just a one and done. Some people just splash a little water on their face. Sometimes I have a patient come in and they have 10 different things that they use, but it gives me an idea of who I'm dealing with. Walking down any skincare line or hall at a store, it's completely overwhelming with what's out there. So I want to help eliminate that confusion and that sense of overwhelming. I want to know what she's comfortable with. Right now she's using just a couple of products in the morning time. She's open to a few more steps at night. We offer medical grade skincare products here, so their active ingredients are able to penetrate your dermis and create change in the skin. And so I want to be able to recommend a product line and a regimen for her that's going to work for her. So I'm not going to send her home with 5 things to do in the morning time. I'm going to send her home with 2 things to do in the morning time. That way I know she's going to be compliant, she's going to be comfortable with it and not overwhelmed. So that's the reason behind that question there. So great. Okay. So, typically I like to know what you have done thus far. I know you've used some skincare. Have you ever had any procedures done for your skin?
I've had hydrofacial
Okay.
before. I
Awesome.
loved that, so relaxing. But I haven't had any other skincare procedures. Yeah, I haven't.
Okay. So I love hydrofacial. In fact, I like to do a hydrofacial first on my patient before I do any other procedures because it gives me a way to get to know their skin. I like to see how sensitive it is, how tolerant it is. I want to get their pores good and squeaky clean. So as we move forward in our relationship, whether we're doing microneedling or laser, if I keep those pores good and clean, I'm going to get a best outcome. So also it gives the patient a chance to get to know me, and we start to build a relationship. And so on that first visit with the hydrofacial, you're going to leave here, no downtime, you have a beautiful glow to your skin, and have a treatment plan in place. Once I've worked on your skin for that first treatment, I can really fine tune what kind of treatment plan is going to work best to help you achieve your goals. So that's what we would do for Rachel too. So once I have her on the treatment table, I would take an analysis of her skin and polish, deep clean, and then set her up with that plan. Great. Yeah. Do you have any questions?
Okay, so one question I have is, I've gone to doctor's offices or other treatment facilities before, and I love getting consult in that, individualized treatment plan. What would happen if, you weren't available one day? Do you have other providers that, could kind of assess and continue on that treatment plan?
Absolutely. Well, we take notes, obviously. And I'll form a skin consultation note and in your medical chart, and I will lay out the treatment plan that we have in place for you. And we do have other aesthetic providers here, which are trained and available. So most of the time you'll stay with whomever you start your initial consultation with, but if at any time you cannot get in with me or whomever, one of the other girls, you can always go to one of the other providers. However, if you request to stay with one person, we will honor that request. Now, as far as injectables go, that would definitely be with either Mary Kay or with Terry. And then also, just to let you know, we have the only board certified female plastic surgeon here as part of our practice.
That's right.
So Dr. Lugo says she is available as well for aesthetic surgical solutions. So we are a comprehensive aesthetic facility now.
Yeah. And I have one final question, which would be, I'm in my mid-20s and I'm seeing these concerns, and part of me is like, oh, well, I have a while to address that. What would you say to people that are maybe in my shoes, maybe a little older, who have skincare concerns, but maybe think they have more time to treat it or are hesitant to get started?
Right. I think today is the best day to get started. So, your skin is the largest organ of your body, and you want to take care of that skin, and it reflects your internal health, and it shows on the surface. I think if you have aesthetic concerns with your skin, we should get started on those. We get that question a lot in regards to Botox, like when should I start Botox? Historically, patients would start usually in their mid-30s. That's when collagen and elastin start to deplete at more accelerated rate, and those expression lines become more etched in the skin. So Botox has been started at that point. The thing you want to look at, though, is if you're completely at rest and you're starting to see those expression lines etched in the skin, that's when you want to start. Exactly. So we do have patients in their 20s getting Botox. The thing is, if you wait to your 50s or your 60s to try Botox and you've got those lines etched in the skin, they're much more challenging to correct. So I say, it's best to get started young. As far as the skin treatments go, procedures are, I see teenagers for some of these procedures. For acne scarring, texture concerns, we will alternate chemical peels and microneedling, and sometimes do some laser genesis. So we have a lot of tools in our toolbox that can address different conditions throughout the ages.
Great. Thanks so much for sitting down with me.
Sure.
So interesting to know, because I think a lot of times the amount of information, like you said, or the amount of skincare products can feel overwhelming. So I feel like it's really nice to have someone you can ask questions to, and that's right. Sometimes it's just nice to know that someone knows more than you.
That's right. Well, I'm here to take the guesswork out of it. I've got 20 years of experience in the field, and I love working with my patients and helping them get the skin, of their dreams. And as we're all aging, just keeping the skin looking healthy and youthful, and I love that. I love that ongoing relationship, and there's all sorts of things we can do to keep your skin looking beautiful and smooth. And so we are going to get Miss Rachel set up on her treatment plan. And so if you would like to come in and have a skin consult here at Spa Medical so we can set you up on your treatment plan, give us a call. It's 478-743-2299.